Imagine you're terminally ill and have been given 6 months or less to live after fighting a painful disease for years. You've reached the end of the road and you no longer want to live in constant pain and suffering till the bitter end. Were you aware of different end-of-life options that could be available to you? Today, I'm going to expound upon euthanasia and physician-assisted suicide. All of us have encountered or will encounter someone who has had their whole life altered from fighting to survive some form of terminal illness. I remember seeing this firsthand when my grandmother was ready to go. Many feel they want to take back some form of control, or as a 2014 article written by Dr. Anna Dewari published in the Journal of Family Medicine and Primary Care calls it, the right to die with dignity. I desire to share with you, first, what euthanasia and physician-assisted suicide is, second, if and where it is legal, and lastly, what makes it so controversial. Euthanasia and physician-assisted suicide are two separate options that often get coupled together. According to a July 2020 article found in the Medical Principles and Practice Journal written by Dr. Varkey, the definition of euthanasia is the act or practice of killing or permitting the death of a hopelessly sick or injured individual in a relatively painless way for reasons of mercy. Euthanasia is classified as either active or passive, and then into further subcategories which are voluntary, involuntary, and non-voluntary. The previously cited article written by Dr. Anna Dewari defines both passive and active euthanasia. It states passive euthanasia refers to the withdrawing or withholding of treatment which is necessary for maintaining life. Next, it defines active euthanasia as the physician's deliberate act, usually the administration of lethal drugs to end an incurably or terminally ill patient's life. Dr. Anna Dewari continues to describe the subtypes of euthanasia: voluntary, involuntary, and non-voluntary euthanasia. Voluntary is when the patient is able to give informed consent and is asking to be euthanized. Involuntary is when a patient is unable to give consent, and so consent is given by another appropriate party. Non-voluntary euthanasia, also known as murder, occurs when a patient doesn't want to die or cannot or doesn't give consent. Contrastingly, the American Medical Association stipulates that physician-assisted suicide occurs when a physician facilitates a patient's death by providing them the necessary means and or information to enable them to perform the life-ending act. Now that we have considered what these terms mean and the finality in invoking them, let's uncover whether or not these options are even legal. Rules and regulations of euthanasia and physician-assisted suicide vary across the United States. All forms of active euthanasia are illegal in the United States. This has led to death tourism to countries such as the Netherlands, Belgium, and Luxembourg, where active euthanasia is legal. Passive euthanasia is legal in the United States and most other countries because it is the withdrawing of treatment from a patient who will never recover, allowing them to die naturally. Physician-assisted suicide is still up for debate in the United States, however. In February of this year, Procon.org published an article that reviewed what states have legalized physician-assisted suicide. These states, as shown on screen, are California, Colorado, DC, Hawaii, Montana, Maine, New Jersey, Vermont, Oregon, and Washington. In order to seek physician-assisted suicide in any of these states, you have to be a legal resident of that state. Additionally, excluding Montana that has no other legal protocol, you must be at least 18 years of age, have a life expectancy of 6 months or less, and orally request it to your physician 2 times, at least 15 days apart, and give 1 written request to your physician. Now that we know what is legal and where it is legal, let's discuss why it's controversial. Euthanasia and physician-assisted suicide provoke debate in several hard-hitting and scarcely discussed areas within the medical community. As stated by the American Medical Association's description of palliative care, it focuses on improving the patient's quality of life by managing pain and other distressing symptoms of a serious illness. However, some patients are still unable to find solace. How are clinicians, whose duty it is to provide palliative care, help a patient that is not responding to any other form of treatment? Some hospice and palliative care professionals seem to have found a legal loophole around euthanasia and physician-assisted suicide. In 2018, State Line PEW wrote an article about Elizabeth Martin, a woman whose incessant pain drove her mad, after she was unable to be relieved of any pain after cancer had spread to her liver, colon, spine, and eventually to her brain. This legal loophole she received was known as CPST, or Continuous Palliative Sedation Therapy. The American Academy of Hospice and Palliative Medicine explains that palliative sedation is the intentional lowering of awareness towards and including unconsciousness. This typically continues until death. These end-of-life options also serve physicians with a moral and ethical dilemma. Doctors take a Hippocratic oath to first do no harm, but they also have to respect the patient's autonomy and right to choose. Is it moral to continue to allow someone who is terminally ill and is and has been experiencing insufferable pain to live their last few months or days in a state that completely diminishes any quality of life? This puts someone whose role as a healer in a position to end a life by permitting the early release of someone whose life is otherwise intolerable. In conclusion, I hope by providing you with definitions, presenting arguments from the patient's view as well as the clinician's view, and providing information as to where these options are legal you were able to achieve an understanding on what euthanasia and physician-assisted suicide is and all that it encompasses. It is unfortunate that there are things like this today that can affect us so severely, that topics like this have come to light. However, it is one of my passions as someone who aspires to work in the medical field to educate people with the most recent and accurate facts and figures that allows them to make their best informed decision. Thank you.